Welcome everybody, and thank you for coming to listen to me talk this afternoon. I work at Premier Benefits, and we do a lot of this work, so I'm hoping that I'll be able to share some of the experiences that we've had. There are three main areas that I'm going to be covering. The first is assessing the effectiveness of your benefits portfolio as it stands. You can't move forward until you understand what you've got and how that's working for you. Once you do that, the whole aim of this is to provide meaningful benefits for your employees. How do you assess that? How do you value that? How do you analyse what you need? And when you've got what you need to be flexible. And how do you provide that flexibility to employees, addressing all of their needs across a diverse workforce? We don't have a homogenous group of employees all with the same needs, or with the same backgrounds, or with the same desires and lifestyle choices to make. So let's start with how effective is your benefits portfolio. How do you currently check the effectiveness? Do you take anecdotal stories from your staff, or do you use hard evidence based on statistics, data analysis, and all the tools that you have available? I've picked a few of the tools here that some of our clients use. Quite frankly, if I was to put them all on here, you'd run out of paper very, very quickly. It depends on the systems that you use. It depends on how you organise your benefits. Many of our clients don't have one department looking after all of their benefits. You may have a pensions department, reward and benefits, HR, well-being, and each one of those will have their own remit, their own objectives, their own budget maybe, and certainly their own way of working. And one of those ways of working will be to gather the data that's pertinent to their particular responsibilities. My experience tells me that the most effective way to get a really good strategy in place for all of your benefits is for you all to work together. And that's sometimes easier said than done. But if you can get everybody either in the same room or at least talking through some sort of electronic webinar to talk about what your objectives are, what data you have, then that's a really good start. Using things like Google Analytics, staff surveys, behavioural analysis on what people are actually doing, as well as marrying that up and matching that up with your demographics. Or are your people all in one place? It's doubtful. Are they located in the countryside, in the town? Are they located working at home? And do you have specific particular traits that are common for those locations? It's really important that you understand those people so that you can look at that data and not just look at it at face value, but look at it really intelligently. So how good is your data? Even the biggest companies that we work with thousands of employees, with multiple locations, struggle with this. It's not easy. So sometimes a little bit of help is necessary. As an example of some of the data that we use with our clients, anything that's web-based, you can get these Google Analytics, and they're actually really quite useful. They're not the only source, and they certainly should be used with care. But you can see here, you can identify the number of first-time users to a website, the repeat users, how long they've been on the site, when they've accessed it, how they've accessed it. Is it through a tablet or a mobile phone, or through their workplace desktop or laptop? All that's really useful, because when you're building a comms plan, you need to work towards the areas that they're going to use. Once they go onto your benefits portal, if you have one, or your selection tools, what do they actually select? This is just a very brief snapshot, and you'll see here that the two most used benefits, or most selected benefits, are the health cash plan and the pension. Well, that's not a surprise, because in this case that's funded by the employer. In other cases, you'll see different selection rates for different age groups. And it's a thing that we've built up over time, is looking at the benefits that are more attractive to different age groups. It's a really general tool. It's not particularly detailed. But actually it gives you a good indicator. If you've got everybody in your 20s, 30s and 40s, there's no point in offering retirement advice. It's not exactly logical. So there are some uses to that. The other thing is that we've found that some things that you think are going to be age-specific really aren't. So things like being able to offer flexibility, working flexible hours, being able to have the ability to work at home or to choose to work outside of the normal working hours. I think there's a perception in many organisations that that's really something that you do when you've got young kids. You know, it gives you that ability to take them to school, pick them up after school, have their friends around, do tea, and then put the kids to bed and get on working. Actually, the reasons might be different, but older people like that too. I know that because my kids are all grown up and I've got elderly parents, and I might actually need to go and take them to the doctor in the morning. The difference is not the benefit or the flexibility that you're offering, it's just the reason that it's needed or wanted. So using this data, you have to be quite careful. You have to look at it in multiple areas and overlay the different parts of the data together. Staff surveys, well, this isn't even a question, it's just a pie chart. But actually, do you do staff surveys? A lot of people do. And a lot of clients say, well, I'd like to, but I'm really nervous. Because if I set a staff survey question, there's going to be an expectation that I'm going to do something. So using the actual objectives you have as a company and working out what questions are going to be useful without setting some sort of expectation that we're going to fill that gap. What are we going to ask? How are we going to ask it? How is it going to then be useful to us? And one of the really easy things to measure, or should be one of the easy things to measure, is your absences. And in this case, I haven't put any numbers on the number of absences. I've just said, okay, which departments, in this case, have got the most absences in terms of percentages. And that also ties in this case, with locations. And so looking at the benefits you offer, the locations of those people, what they're choosing, the ages, the number of hit rates on the website, where those hit rates are coming from, whether it's, in this case, the trainees, admin, manufacturing, management, who's accessing how. All of that has to be brought together and glued together to try and get some sense to work out what your benefit strategy should look like. It's not simple. There's a lot to it. And the way that we start with all of this data, and you think, oh my goodness, what am I going to do with it? How am I going to organise this data to actually build a strategy that's going to work for my wellbeing colleagues, for my pensions manager, and actually give something back to the C-suite that shows them there is a return on this investment as well. So we start at the top of, I've got a couple of pyramids in this presentation. This one is the first one, and we start with the culture of the business. The culture of the business, or the culture you want to try and encourage on the business, the one that you're aiming for, will be the driver behind the types of benefits you offer and how you communicate to it. You will have a finite budget. Wouldn't it be lovely if we all had bottomless pockets? Looking at all the benefits that are on offer outside, you know, there's some fantastic service provisions. How on earth do you choose? So one thing that we can do is look at both funded and unfunded, the ones that the company feel or need to fund, and the ones that the company want to fund may be different from the ones that you want to offer as self-funding. Once you've done that, you've got health and well-being, you've got lifestyle, and you've got financial. So we can filter that down, and that's the start of your strategy. But understanding your culture, or where you want that objective to be coming from, is a key part. Wow, all these benefits. Some of them are out there, some of them aren't. Some of the ones that are out there aren't in here. But it is a bit like that, isn't it? Your mind just gets absolutely full of what you'd like to do. But how many of these will suit all of your staff? How many of them will be relevant? And that's where we got to start from. So this is my second pyramid. You will have in your organisation a total budget. We need to make sure that that budget is used in the best possible way. So there are some things that you have to provide. You have to provide your pension contributions. It's a regulatory requirement. So that almost has to come out before you've done anything else. Then you'll have things that you need to provide to attract the staff that you need, you know, the core benefits that are expected in your peer group. If you are expected to provide a certain level of life cover, private medical insurance, income protection, those almost have to be put in the same bucket as your pension. What you should also have in that bucket is your communications budget, because there is absolutely no point in doing anything else unless you communicate it. It's just like throwing money down the drain. So then you come to those benefits that are wanted, that are required, expected, and looking at the health, lifestyle and financial benefits, which ones do we fund and which ones do we just give access to. And getting everybody in the room, from the pensions manager to the health and wellbeing manager to your reward and recognition remuneration team, getting all those people in the room is really critical, because your benefits will support your wellbeing. Your wellbeing will inform the benefits that you want, and the data should be showing how a campaign in wellbeing affects the behaviour of your staff, affects what they click on your benefits portal, what they select, what they buy or what benefits they take, and then you should get through right to the very end of the impact on your bottom line, either your productivity, your absentee rates, your staff turnover, or whatever it is that we've identified with you that you can measure. And that's the objective, to go through with each of your benefits and say, this is what we've done, this is the impact, and how do we follow that through? So designing your pyramid is the simple thing. It's a bit like an asset manager saying how much is going to go into equities and how much is going to go into bonds. That's the high level. The detail will then come as you go through all those benefit providers out there and say, well, I'd really like to give some financial education, really want to give some dental cover, I'd really like to do this. Well, you know, you have to be realistic, and you might not be able to do it all. A couple of things that some of my clients have done, just as ideas, is that when they do their renewal, we go through a process where we look at the data that's available. And I have to be honest, some of the data that's available is not what we would like. We would like more, and they would like more. So we don't always start with this magic bundle of charts and graphs and things. You start with what you've got. And with one example of one client that I did, we have a guest benefit that gets introduced, and it's when the benefit platform opens, we have a guest benefit for 1 year only. We're going to trial it out, see if it works, see if it's popular, see if it's wanted and appreciated, and if it works, it gets added to the next year. Sometimes as a voluntary benefit, sometimes as a funded benefit. But that's a quite nice way of introducing one without committing to it long term. There's another client of mine who didn't really believe in health cash plan. I'm a big advocate for health cash plan. I think it gives you a lot of cover for a relatively low price, and it's everyday health things. You know, you've got glasses, you've got teeth, you've got ears, you've got a back that gets sore every now and again. It covers all the things that most of us have problems with over the course of a year, particularly as you start to get older like me. So if you've got that, brilliant. Well, this client said, well, I'm not really sure. So we'll introduce it as a voluntary benefit. So it wasn't a guest, it was a voluntary benefit. It went down a storm. Absolutely loved it. You've probably got experiences of your own. The following year, they introduced it as a core benefit, paid for by the company. Well, one benefit was that the cost came down because it was paid for by the company and everybody had it. But also the appreciation from the staff, because it was something that most people could use, was massive. So there's different ways you can develop your benefit strategy. Once you've identified what that bottom budget is, after those essential things have been taken out, but working with your colleagues in wellbeing, working with your colleagues in pensions and the wider HR can really help develop then your communications. I'm going off a bit. And to make that budget stretch a little bit further is going to be critical. So using your data, once you've got a few benefits on there and you've got some data sets that you can grasp, then look at who's doing what. Look at the voluntary versus the funded. And if you've got employee forums, employee work groups, a lot of companies have them, whether it's a social group or whether it's something more formal. Tap into them and really make use of them, because they can be your ambassadors. They can do some of the communicating for you. There's a little spike in there in February, but you can't guess what that was. This is the usage that we showed earlier on the platform, and this is where the benefit window opened. Okay, so you can see then it had an impact. You've seen these stats before. We all know there's a link between mental health and absenteeism. You may have also seen some of these before as well. We've got about over 10% of retired income families still working. How many of your people over the age of 65 are working? Have you got benefits that actually work for them? Interestingly, I'm going to go through these quite quickly because I'm running out of time. Interestingly, 33% of 35 to 44-year-olds have less than £100 savings. That's pretty scary, isn't it? So that's something that, again, looking at a different cohort in age group, we need to try and address. 36% of 25 to 34-year-olds own their own home. That's not bad, but actually if you go back to 1998, the figure was at 55%. So not only are people not owning their own homes like they used to, when they get to that next stage cohort, 35 to 44, they haven't actually got any money. So they're not going to own their own homes. Now, some of you might have locations for your sites outside of major towns and cities and rely on public transport to get to your locations. A really easy benefit that can be arranged, if you are in that position, you are probably going to have staff that rely on a car or rely on a lift or rely on a public transport to get in to your office, and they can't drive. The number of people now who've fallen in that young age group, 17 to 20, who haven't got a driver's licence has fallen dramatically. It's so expensive. So if you've got that, talk to your local driving school, buy them a cup of tea and say, if I can put a poster up in my staff room, publicise your driving school, will you give them a 10% discount? It's another benefit. Help the local business school, driving school, help your staff, big brownie points, and it's cost you a cup of tea. I'm talking a cup of tea, we drink a lot of tea in this country. So make sure you've got some nice tea bags. Flexibility is the last thing, and I'm going to be really quick on this because I think you've probably seen quite a lot of flexible platforms that are available, bringing it all together, giving that access, giving that instant gratification, whether it be on your mobile phone and getting that voucher or going online on your desktop at work. Being able to build a profile yourself to get those nudges and reminders, whether it's, oh, my car insurance is due next month, or remind me that, oh, actually it's my birthday, I'm going to give myself a birthday present and increase my pension contribution by 1%. Yee. Whatever it is, you need to let them do it. Then it's not going to be badgering them, it's going to be helping them, and they'll be welcoming it. And effectively communicating those peripheral benefits. If you ask any of your employees what EAP means, do you think they'll know? Having a way to access that benefit without calling it EAP, saying you've lost somebody close in your family, you need some help with the bereavement, go to the EAP. Show them the route really clearly through that communications and getting feedback. I've jumped around a little bit because this is such a big topic, but all of this will feed into your strategy, and getting the data at every point, build that picture between making that communication and the results. What you're aiming for at the end of the day is to get those benefits, get them aligned with your corporate strategy, aligned with your employees' needs and desires, and be able to prove to that C-suite that you've got a return on your investment. I'm going to have to get through that. The benefits governance is a bit like pension governance, just review and come back, but I'm running out of time. I've been talking too quickly and not enough. Where do you start? This is my last slide. We do a free appraisal, wellbeing appraisal on our website, and one of the key areas that we found is that a lot of people want to do a wellbeing strategy and a benefit strategy that encompasses all of this and really don't know where to start. 55% of our participants just say we haven't got the time or the resource. 29% think they just haven't got the expertise. That's what people like Premier and a lot of the others in the room here today are there to help you with. So please ask for help, because by bringing all this together, you can create amazing benefit strategies for your people. I hope that's been a little bit useful. Please do have a chat with me afterwards, and best of luck.
Thank you so much.